Hello, I am Dr. Rajiv RT. So, we'll have a lot of discussion on these three important organs. So, we'll have our heart, we'll have our lungs, okay, and will have our kidney as well. So, we'll integrate all the important, uh, you know, diseases, all the important uh, drugs, okay. So we'll find the etiology, all the infections, all the iatrogenic causes, all the inflammatory causes. We'll go through the traumatic causes, we'll go through the tumors, okay. So we'll have this all integrated, okay. So first most important part, uh, let's discuss is the vascular part, okay. So vascular part is the blood, okay, blood and blood vessels, right. So that will be also included here. So this is the thing which connects all the three organs, okay. So whatever like hormones or anything, for instance, if any infection is also there, it will travel via blood. So we'll start with the normal system in the RAAS system. So you have a brain, we have liver, we have lungs, and we have heart. We have what we have. This is kidney, and this is adrenal, right? So there is a connection between all of them. All right. Now, so we've started very slow because it's a long process. It's a marathon of all the disorders. So we'll go through all the disorders also one by one. This is the first video, this is the 0th video. uh, I promise it will be not a boring sessions. So let's start, okay. So 2 minutes over, so let's start. So there is a connection, we'll go through all the connections, how these all are actually starting, right. So okay, so first we'll go through the brain. Brain is the master, okay. Brain is the master of all the control and coordination of the whole body, right. So what happens, it not only controls via the hormones, it also control everything, like it controls the heart also. Even the heart controls the brain, it sends information to the brain, it says the brain what to release and what to not. So there is an interlink and intercommunications between everything, right. Like interleukins are there between the between the organs, also between the cells, and the between the leukocytes. So we'll go very slowly, okay. So let's start. The first topic which we are going to discuss is hypertension and its comorbidity. So let's start with hypertension and comorbidity, which has, for example, metabolic syndrome. So what do you mean by metabolic syndrome? Okay, we'll go one by one. So metabolic syndrome basically is a triad of hypertension, type 2 diabetes, and dyslipidemia. Okay, so metabolic syndrome is basically what? Metabolic syndrome is syndrome X. Syndrome X. So it caused by insulin resistance. Caused by insulin resistance. Okay. So there are few parameters to define metabolic syndrome. The first is the central obesity. The second is triglyceride level. The third is HDL level. The fourth is the blood pressure, and the fifth is the fasting blood sugar. Okay, so for male, the central obesity, the waist circumference for male is more than 102 centimeter. Okay, for female it is more than 88 centimeter. The triglyceride level in male is 150 more than, all right, in female also 150. HDL level less than 50 and less than 40. In BP less more than 130 by 80 in male and more than 130 by 80 by for female also. So 130 by 80 is the parameter, 120 by 140 by 90 is the oldest old parameter. Okay, so this is basically the ATP criteria for metabolic syndrome. ATP criteria for metabolic syndrome. FBA sugar again 100. Okay, so if there is 3 or more than 3 criteria present, it is known as syndrome X. So in syndrome I'll write like this. Okay, whatever I've learned from my teachers, so I want to teach you in the we'll discuss in this way. Okay, so this is syndrome X. Basically very important क्या क्या है parameters देखो. LDL is not in the criteria, is not into the criteria. सबसे पहला, ठीक है. सेकेंड इम्पॉर्टेंट पॉइंट क्या होगा. ड्रग ऑफ चॉइस फॉर लो HDL इज स्टैटिन. सबसे पहले स्टैटिन देते हैं, उसके बाद निकोटिनिक एसिड. तो हम लोग जब when we will read about dyslipidemia, then we will learn where you have to use fenofibrate also. Okay, now drug of choice for hypertriglyceridemia क्या होगा. statin more than fibroids and more than fibrates. Okay, so now very important, a new parameter for syndrome X is proinsulin, where proinsulin to insulin level is more than 18%, I mean, what means 18 by 100. So if there is proinsulin 18 and insulin 100, okay, so anything more than this is considered to be syndrome X. Okay, so syndrome X basically means what? It means hypertension, diabetes and dyslipidemia. Okay, so this is a triad of this. So when I say hypertension and comorbidities, it is just an example that one of the thing is metabolic syndrome. There are multiple. Okay, so one by one we are going to discuss. Now renin and angiotensin are the two major hormones, we can say, which are present, which is considered to be important for hypertension. And here like when there is decrease in BP, okay, there is decrease in blood pressure. So what happens, there is a decrease in blood pressure, so क्या होगा. If there will be decrease in blood pressure, there will be, right, so there will be stretch reflex होगा aortic और कैरोटिड साइनस में, एओर्टिक और कैरोटिड साइनस में. ठीक है, उसके बारे में हम लोग डिस्कस करेंगे. बैरोरिसेप्टर रिफ्लेक्स क्या होता है, दिस ऑल थिंग्स, राइट. सो विल गेट द इंफॉर्मेशन. नाउ दिस विल एक्चुअली व्हाट विल डू, दिस विल गो टू द ब्रेन, to the alpha 2 receptor and activates the sympathetic nervous system. This sympathetic nervous system, what will do, it will act on the beta 1 receptor in the JG cells of the kidney to release renin. to release renin. Now renin, what will do? Angiotensinogen released from the liver. Renin will convert angiotensinogen to angiotensin 1. Angiotensin 1. Now angiotensin 1 will go to lungs via blood again. Will go to lungs. Now here in the lungs there is ACE enzyme. In the ACE enzyme there is ACE receptor. Now ACE enzyme what will do? It will convert angiotensin 1 to angiotensin 2. So we have got angiotensin 2. So in the angiotensin 2, what it will do? It will go and do vasoconstriction, and it will cause increase in BP. Increase in BP. Also, apart from decrease in BP, if there is a decrease in H2 also, there is some blood loss, then also the system gets activated. So what will angiotensin 2 do? It will act on the adrenal cortex, and it will secrete the aldosterone. It will secrete the aldosterone, which will increase what? It will increase the BP, and it will in H2O water intake, मतलब like water conservation ज़्यादा कराएगा. So what will do? It will actually increase the H2O, which will indirectly cause increase in BP. So again, both when the deficiency was relieved. So when the deficiency was relieved, what will happen? This all will go to the heart, and in the atria there will be stretching. There will be increase in the water content, so there will be stretching of the atria and release of the ANP and BNP, atrial natriuretic peptide and BNP. And what it will do? It will inhibit the aldosterone synthesis. It will inhibit the angiotensin receptors. These are the AT1 receptors, okay, in the blood vessels. We will discuss AT1 and AT2 receptors. So it's a complex process of RAS system. Okay, so I think most of you know about this, but still this is a brief discussion. We'll do it again. So this is all about renal. So we'll learn about diuretics also in details. Okay, we'll go for pulmonary diseases like pulmonary hypertension. In the cardiovascular, not only we'll discuss a lot about cardiac disease, we will discuss about the vascular system also. So a third term was the diuretics. Okay, the third was the diuretics. We'll go about all the renal excretion function. We'll go about pulmonary hypertension. We'll go about the dyslipidemic drugs. What are the important dyslipidemic drugs? We are discussing about statins, fenofibrates, okay, fenofibrates, and nicotinic acid. Okay, so we'll go and discuss about these. Now the four important diseases in cardiovascular system is arrhythmia, ischemic heart disease, hypertension, and heart failure. Okay, so we are going to discuss about hypertension and heart failure in recent terms, and then we are going to discuss about arrhythmia and restriction heart disease. Okay, now ischemic heart disease. Okay, so in blood coagulation and anticoagulate, these all are important, where even fibrinolytics and antiplatelets we're going to discuss more about in MI. Okay, in MI. And we are also going to discuss how everything, even hypertension or arrhythmia or ischemic heart disease, will actually leads to heart failure. Okay, so ultimate fate of all the heart diseases, heart failure. Okay, there will be heart failure. Similarly, in all the respiratory disease, it will end in respiratory failure. Okay, so questions in the MCQ will come based on the okay the heart failure, newer drugs, acute and chronic. What are the drugs which are contraindicated in acute, which are given in chronic? Okay, lot about ECG, okay, or the investigations. So in the other video we are going to like integrate more. Okay, we are going to integrate and learn about all the cardiorespiratory disorders, cardiorespiratory disorders. Okay, so in this 15 minutes or 16 minutes of discussion, I have just completed your metabolic syndrome. So this is syndrome X. Okay, and I've just discussed what we are going to do in the recent marathon. Okay, so okay,